So we've all seen the government's zero-rated list for medicine, GST, and currently the number is about 4,215.
Okay.
So you as the deputy president of the Malaysian Pharmaceutical Society, just give us an idea of the impact of this list. I mean, is it as good as it seems, or is it just numbers?
Okay. Basically, we have to understand what National Essential Medicine List is all about. This is basically a basket of medicine recommended by World Health Organization to have in countries, so that this medicine is made available to everyone in the country. So every country in the world, okay, have their own National Essential Medicine List. Okay, so regarding the GST, when the government announced that they are giving zero rated for any ML that we call like this, so you just say that that out of the 320 chemical entities and in 4,200 products, that is the list, which is probably 13% of the total 43,000 registered product in the country.
So basically, what I understand is that the total number is 4,000, over 4,000. A lot of things are repeated. For example, paracetamol.
Yeah.
There are different brands of it. So
Exactly.
all of these is considered as one. Each brand is
Okay.
one.
For if you take that as an example, so as a chemical entity, so we're talking about paracetamol.
Yeah.
So this one of the 320 chemical entities, but this paracetamol come in 17 products.
Okay.
So in the list will become 17. So the 17 is part of the 4,200 products.
So then, basically, out of the 4,000, only slightly over 300 is actually different types of medicine.
Yeah, the different type of chemical entities is, covers 320. Of course, we will talk about, well, when you talk about National Essential Medicine List, we are talking about does it covers in terms of coverage, in terms of this one. So, well, it will still covers the 30 what you call diseases and so on. But usually the National Essential Medicine List covers first line. First line. Okay. For example, you talk about antibiotic, is the first line. But situation in our country is different. So we are talking about people are using second line or third line, or probably if you talk about major hospital, which actually covers tertiary care. So we are not talking about the national essential medicine anymore. We are talking about a different class. So when that doesn't cover the newer drugs, so that's another challenge. So this is something that we are aware. Okay, MPS is really very concerned, because right from the very beginning, okay, we are concerned because if you can recall, when the government decided to have GST way back in, if I'm not mistaken, on 25th October 2013, okay, when our Prime Minister announced. So right after that, okay, we can see that the discussion has started already. Should we include medicine or not? Alright, okay. So currently, the current situation is that there's no tax on medicine. That is the current situation.
Okay.
Alright. So if you put in any tax, so it will affect the what you call the rakyat lah. So these are the things that we have to be aware. So I think in terms of our engagement with the government, okay, we requested zero rated for all.
Yes.
That was actually our first engagement.
So basically, from what I understand, is that not only your organization, but also pharmaceutical companies have actually lobbied for a bigger list.
All right.
But why was it rejected?
Okay, I think going to the phases, when we say we here means the Malaysian Pharmaceutical Society, as well as our we call it our sister organization lah, the Malaysian Cooperative Pharmacists Guild. Okay, when we discuss with the government, we say that we want that. All right. So obviously nothing happens. So they will still discuss with the pharmacy services division of the Ministry of Health. So the discussion is there. So in fact, the pharmaceutical division, okay, the pharmaceutical division actually bring up to MOH and also presented to Ministry of Finance. But the what you call whatever decision lies with the Ministry of Finance, which is actually under our Honorable Prime Minister.
So basically, you can only make recommendations.
Yes.
And that is decided by the Ministry of Health, and then it goes to the finance. Is that
through Ministry of Health. I think we can't blame Ministry of Health.
Yeah.
Yes, because they actually negotiated with MOF. So the one that making decision is Ministry of Finance lah.
So this is a wholly economic decision. It's not so much about the welfare of people, but so much how much tax they're getting in return.
I wouldn't say that lah. But what I'm trying to say, probably the thing is new. GST is something that is very new. So maybe they have set their own KPI of tax collection and so on.
So basically, when we look at GST, a lot of people argue that it's just 6%. So but a bulk of medicine purchases are actually very costly.
Okay.
So and 6% is very substantial when you look at the overall cost.
Okay. All right. Okay.
How much will the people be affected by GST?
Okay, as I mentioned just now, medicine are not commodities, so people do not want to get sick. Nobody want to get sick, okay? Especially the kind of diseases I mentioned earlier, okay? So when it happened, and so it become, something, a form of suffering lah. Okay, rather other than the symptoms and of the disease, and then now we come up with a financial burden. The reason for this is the fact that we have to address the healthcare system. Okay, at the moment, the dual system of public and private currently, in my honest opinion, is not sustainable.
With the list we have at the moment, would you say you're disappointed, or are you happy with the list?
To say happy, of course, we are not happy, to tell you frankly, because we are doing it for our patient. Okay, we are doing it rightly for our patients. So, as a professional body, Malaysian Pharmaceutical Society, actually when we talk about our own motto is that we actually berkhidmat untuk kesihatan rakyat. So, this is our commitment to the rakyat. So, as long as we can keep doing, requesting, it's not going to be the end of the story. So we still need to do more engagement, more and so on and so forth, so that we can move further in the future lah.
So one last question before we let you go. Basically, you say until midnight tonight. You're
I'm still praying.
Still waiting for a response. Assuming that the government doesn't respond positively to your appeal.
Okay.
What then? You have to wait for. When's the next window of opportunity where you can actually sort of put in your views again, or is it constantly
we will still continue. We will engage with people. Maybe we will work together with the consumer groups, to get them understand, and then probably then we can make up together. I think as far as for the pharmaceutical industry, in terms of pharma companies, our local industries, MOPI, and also our Malaysian suppliers, MAPS. I think our stand is very clear, that to make it under the national medicine policy, to make medicine accessible to rakyat. So I think we just have to keep pushing. So maybe the more we can push will be better.